Center for Disease Control reports that the number of people diagnosed with diabetes in the United States has tripled during the past 20 years and now includes more than 1 out of every 4 Americans over the age of 65. Tragically, one of the complications of diabetes can be vision impairment or blindness caused by the damage to the blood vessels that nourish the retina. My name is Paul Raskin. I am the Supervisor of Instructional Services here at Vista Center for the Blind and Visually Impaired. The purpose of this video is to discuss some methods of helping people with partial vision or blindness to manage their medications independently. When teaching medication management, you should always keep thorough records to document a client's level of independence. A client who has difficulties with confusion or a memory deficit and may accidentally overdose should not be provided with instruction. Rather, it is better to recommend that a caregiver help with these medications. You should advise anyone who uses insulin or any other injectable medication to always use a sharps container, even if they have no communicable diseases. It's just logical courtesy. When you are working with a client who during the course of your lesson will draw blood or inject himself with a medication, you should use standard precautions. You can learn more about standard precautions on the Red Cross website, which is www.redcross.org. Let's start by discussing insulin delivery. Probably the easiest method of insulin delivery for a person with visual impairment or blindness is the insulin pen. I'm holding a typical insulin pen. This is the Levemir Flex pen. It's about 6 inches long, and one half, we'll call it the top half, is covered by a protective plastic sheath. When you remove the sheath, there's an insulin vial encased in plastic. At the very top of this pen, there's a threaded area where you can put the needle. The needles come separately. They're pretty small. In order to put them on, you need to peel off a protective paper backing, and then it just screws onto the tip of the pen like this. This one has 2 protective plastic covers. I'm going to remove them. The actual needle is very tiny, very hard to see actually, and almost painless, I understand. The bottom part of the pen, the very bottom, maybe ½ an inch, rotates, and this is how you dial insulin. As I turn it, you're going to hear a click, and I can feel each click. Each click represents 1 unit. On the very, very tip of the bottom is a trigger. When you push the trigger, insulin's injected. The manufacturer recommends that you prime the needle each time you put a new needle in, and also test that the needle is working properly by injecting a couple units of insulin into the air. Now, if you can't see very well, in fact, even if you can see very well, it's very hard to see that insulin. It's also very hard to feel little tiny drops. So what I recommend is that you take a Kleenex and actually inject the insulin into the Kleenex, like that. It's much easier to feel the insulin in the Kleenex than it is looking, especially if you can't see. By the time you see a patient or client, hopefully the diabetes educator will have instructed him or her to keep the needle in the skin for about maybe 5 or 6 seconds after the injection is completed. And that's because these needles are so short that some insulin leaks out. Once the client has injected the insulin, it's best to have him remove the tip, not by covering it with the plastic cover because it's so easy to poke yourself. The best way is to have the client reach up from the bottom to the top and just turn the needle until it comes off and dispose it directly into the sharps container. The insulin pen is very handy, but it's not perfect. For one thing, it's expensive. Some people can't afford it. Sometimes insurance won't cover it. People who mix their insulin can't use it because you can't mix insulin. And also, not every type of insulin comes in a pen. So for people who can't use a pen, they need to use a syringe usually. Syringes are pretty commonplace, but the problem is for a person who's visually impaired, it's very hard to see these numbers. So Probably the most common device we have right now to help out is called a count-a-dose. The count-a-dose has two parts. There's the vial holder. The vial holder has two holes, one for each vial. And they fit pretty snugly. Go. There we go, like that. I have two vials here. We'll call them vial number 1 and vial number 2. The other part is the syringe holder. And I have a 1/2 cc BD syringe here. I'm going to take the plunger cap off. The syringe fits pretty neatly inside the syringe holder. There's a little arm that goes over the barrel, and the plunger fits in very neatly. And then we can just remove this needle from the needle cover from the needle like that. Now let's say we're going to mix 10 units of vial 1 and 10 units of vial 2. It's a little bit tricky. So what you need to do, it's important to remember that you can't withdraw insulin from the vial without injecting air first. So we'll start by adding 10 units of air into the syringe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we're going to put the vial holder right over the needle. We'll start by putting vial number 2 over the needle. When you put them together, the needle automatically goes right into the vial. It's very smooth. So now we'll inject that air into vial number 2. 1, 2, 3, 4. There we go. Look at that. Okay, so now vial 2, it has 10 extra units of air. We'll take the vial holder off. Now we need to withdraw another 10 units of air into the syringe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Doesn't really have to be precise. Now we're going to put the vial holder again, so number 1 goes right there, you go, like that. Now we're going to inject the air into vial number 1. Okay, so now we're going to withdraw 10 units of insulin from vial number 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're going to take the vial holder off, turn it around. So now vial number 2 is going to be over the needle. Now we're going to withdraw another 10 units from vial number 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so now we've mixed our insulin. We'll take the vial container off. We've got to very gently now remove the syringe from the holder, and we're ready to inject. There are some problems with this unit though that concern me. One problem is that when you remove the syringe from the syringe holder, it's very easy to move this plunger in a little bit, and you might lose maybe a couple drops or maybe a unit or 2 of insulin. And if you only are measuring a small amount, that's very significant. Another problem is it's hard to keep track of how much insulin's in these vials. It's easy to run out and forget you've run out and start withdrawing air and injecting air, which isn't good. So we need to devise some kind of method of keeping track of when the vial needs to be changed. It's always good to always leave a little bit of insulin at the bottom of the vial, just to be sure, because in case you miscount a little bit. Some people are able to keep a calendar. They keep track of which day the vial should be empty, and on that day they'll remove the vial, put a new vial in. That's one method of doing it, but of course you've got to keep track of the date, which isn't easy for everybody. Another method is to maybe have a huge bowl full of marbles. And since there's 1,000 units in each container, it takes a lot of marbles. What you might want to do is have a bowl of marbles, and each time you remove a unit, remove a marble into another bowl. vials are gone, it's time to switch vials. There's other methods too. One method that some people use is they put rubber bands around the vials, maybe one rubber band for each dose. As you give yourself a dose, you remove a rubber band. When all your rubber bands are gone, it's time to switch vials. For people who have low vision, sometimes magnification helps. I have a little gadget here. I don't know if it has a name or not. They just include this gadget when you buy a whole bunch of syringes. It just clips on like that. It doesn't provide much magnification, maybe 2 times, maybe not even that. But for some people it's enough. Another common device is called the Magna Guide. This is the Magna Guide. It's a little bit different in that it can actually hold a vial. You just clip the vial in here in the top, and then you insert the needle. And the advantage is it holds it as one unit, and then you can just pull out the plunger. It does provide some magnification. Once again, it doesn't provide that much magnification, maybe 2 times, maybe not even that. But for some people it's enough. We're using a CCTV to magnify the syringe, and you can see I put a little bit of red fluid in here for the contrast, and you can actually use a CCTV to verify that you've gotten the correct dosage. Some clients want to know about the possibility of using an insulin pump, and I can tell you that some of our clients are using insulin pumps. It does take either a little bit of vision or else it takes someone with sight to help out. So if you do have some vision, maybe you can use a magnifier or a CCTV, or maybe you can use your spouse. If you don't have a spouse, maybe you can get married. But it is possible to use a pump. A lot of our clients are doing it. If you want to use a pump, probably the best thing is to talk to your diabetes educator, and they can show you a pump. Sometimes you can try them for a few days using saline solution, and for some people it's wonderful, for some people it's not. Let's discuss oral medications. I didn't bring any liquid medications with me, but what I recommend my students do is when they get their medication from the pharmacist, be sure to ask for a funnel, a little funnel. And then what I normally have them do is get some metal spoons, teaspoons, tablespoons, and bend them so they make good dippers. You then take the medication, pour it into a shallow bowl, and you can dip the spoons into the medication and take the medication. Then you put the funnel back in the medicine container and pour the medicine from the bowl back into the container, and then you're ready for your next dosage next time. When it comes to oral medications, there's all kinds of possibilities, and most of the possibilities involve different kinds of labeling. If you need a real quick fix, if you need a medication labeled very quickly, you can always do this. I've taken a medicine bottle, put it in a Ziploc bag, and I've got this large label here. If you have any vision at all, you can probably see this. This is Actos. If you can't see it, we can also use puff paints to make a tactile label. This is a very quick solution. You can also just take a piece of paper and type out a large print label and just glue it onto your bottle like this. That's also a fairly quick possibility. There's other techniques we use too that are more sophisticated. One thing we've been using is smartphone technology, and it's amazing what smartphones can do right now. I have a bottle, I've got 2 different kinds of labels on it here. I took some little stickers, and you can take any kind of stickers you want. Whether it could be stickers that your children have or anything at all. I just grabbed some little plastic stickers and stuck them on here, and I'll tell you why I did that. There's an app now you can get for your smartphone that's called Recognizer. It's made by a company called Looktel. And what you can do is you can just aim your smartphone at any kind of object at all. Actually, it can be your dog, it can be a medicine bottle, spices. You just aim your smartphone at the object you want to identify, tap it twice.
Hold still. Speak your description after the beep.
Valium, 5 milligrams, take as needed.
Description saved.
And then, when you want to identify your medication, you just aim your smartphone at the medication and Valium, 5 milligrams, take as needed. That's pretty cool, huh? There's another app called Talking Takes that you can get for your smartphone. And Talking Takes are kind of interesting. I've already put one on here. This is a Talking Take. They come in all kinds of forms. This is a strip of all kinds of Talking Takes. You can get them for a few pennies a piece. And I just peeled one off like this. I put it on here. And let me show you what I did. So I've pre-recorded something. Let me see if I can retrieve it. Very similar to the other app. This doesn't really require vision. You just aim the camera towards the label, tap it a couple times. Actos, take at bedtime. And then again, when you aim the camera at it again, it should tell you. Another similar labeling device is called a Pen Friend. It's much more expensive, costs a few $100s. For the same price you could probably buy a smartphone. But it works similarly. It comes with some labels that you just peel off. You put it on the medicine container like this. You put the Pen Friend up to it, push a button, say what the product is, and then next time you put the Pen Friend up to it, it'll tell you what it is. Very similar to the other products. Some of our clients like to organize their medication with organizers like this one. This is the kind that I like. It's pretty simple. There's only 7 little windows, one for each day of the week. There are some that are more complicated that drive me crazy though. For example, there are some that have, instead of 7, they have like 4 for each day. So actually there's like 28 different windows and it gets kind of confusing. I prefer a simple one like this, and if a person needs to take doses more than maybe once a day, or what they can do is they can just put little dots on the back, like maybe 1 dot for the first time, 2 dots for the second time of the day, and so forth. But I think simplicity is better. So you can see this has large print. What you can't see is it also has little Braille dots. And I didn't mention Braille. Braille can be pretty convenient, but it takes a little while to learn. I think you can learn just maybe the basic 26 letters. That's enough for most people. Once you learn Braille, you can actually label anything. This is a very simple machine. This is a Dymo Braille labeler. And you can just dial anything you want in here and make Braille labels. You can label your spices, you can label your grandkids, anything you want. Anyway, they're a little expensive, but I think they're worth it. Let's talk about blood testing. Anytime you're working with blood, you need to use standard precautions. If you want to know more about standard precautions, you can find information on the Red Cross website, www.redcross.org. Self-testing has evolved over the years. It used to be that the only way of self-testing was through urine samples, but those days are over. The equipment has gotten smaller and smaller. This is one of the old units that we use. This was the state-of-the-art for many, many years. It's called the AccuCheck VoiceMate, and you can see it's a huge dinosaur. It also took a lot more blood than these units do today. The battery didn't last very long. It just wasn't as good as the units we have today. And also, take a look at these strips. These are the old strips we used to use. Speaking of dinosaurs, these things are humongous compared to the strips we use today, and they don't use capillary action. So let me show you what we do use today. On late night television, you'll hear about a lot of talking meters. They're everywhere. But there's only 3 that we've been using at Vista Center that are pretty good for blind people. And let me go through them with you. There's several qualities of a good meter we're looking for. We want a meter that doesn't require any coding. Coding is difficult for a person who can't see. We want a meter that only takes a very tiny sample of blood. The less blood, the better. We want a meter that doesn't require any sighted help. A meter that a person can take right out of the package and use, even if they can't see. We also want a meter that has a clear voice with sufficient volume. For some people who can't hear very well, that's very important. At Vista Center, we're using 3 meters primarily now, and I'll show you what they are. They're all about the size of a cell phone, and they all don't require coding. None of them do, but there are some differences. This is my favorite right now. This is called a Solo. It is available in several languages. It doesn't require coding. It takes a very tiny sample. Okay. The people who make this product advertise that this machine will let you know if there's not enough blood on the strip, whereas some of these don't. A lot of these machines will give you a false reading, usually kind of low, but the Solo claims that it will always give you a warning if there's not enough blood. That's one of the main differences. It's not a perfect unit, though. One of the problems with this is it's fairly new, and I don't know about the availability of this unit. It's fairly new, there aren't many distributors, and it's not very well covered by insurance yet, but it does have promise. The other meter that requires no sighted help after when you take it out of the box is the Prodigy Voice. It also requires no coding. It takes a tiny sample. It's really a good meter. The only problem that we've had is that some people say that if there's not enough blood in the strip, it'll give you a false reading. So we tell our clients that whenever there isn't enough, whenever they do get a low reading, they should always double test. Make sure that it's not a false reading. Another problem with the Prodigy Voice is it only speaks English, which is a problem, especially where we live in California, where a lot of people speak Spanish. So this other little Prodigy here, which is called the Prodigy Autocode, does speak Spanish and a couple other languages. The problem is you can't take it out of the box and use it if you're blind. So right now there's no perfect meter, but these are the 3 that we're using most commonly. Smartphone technology is changing the face of blood glucose testing. There's a new device called a TelCare. It looks different than the other phones, and it doesn't do quite as much actually. For example, it requires a larger sample, the battery doesn't last very long, in fact you've got to recharge it. But the one thing it does do is it'll broadcast the information from the phone to their website. Then the website will text message your telephone. If you're using an iPhone, you can use VoiceOver to actually hear the results. You can actually send the results to your doctor, or your friends, enemies, anybody you want. Another gadget that's out, I don't have a sample, it's brand new, it's called the IGB Star. And this is a gadget that will actually fit onto your iPhone. And you actually put the strip in, test your blood, and it goes directly into your iPhone, and we'll speak the results through VoiceOver. It's really quite a development. More developments, I think, are pretty much on hand. One of the most difficult parts about testing your blood glucose if you can't see is getting the blood on the strip. It's a lot harder than it sounds. The more blood you get, the better. There's a positive correlation to the amount of blood you get and the chances that you succeed. Good preparation, I think, is a key. We have some of our clients kind of milk the blood down to their fingers. It doesn't sound like it works, but it does work somehow. Also, if you have a warm hand, it's better than having a cold hand. Anything you can do to get more blood will be beneficial. We have different techniques that we've been using over the years. One of my favorites has been to sort of mark the spot with your thumb. That way if you poke yourself, you can kind of get some idea of where the blood is, and that way you can match it with a strip. One of my colleagues uses little rubber bands, and she thinks that works okay. Some people say that the angle of the strip is important, and I'll show you what I mean.
Thank you for using Prodigy Voice.
I'm sorry about the voice,
Today's date,
but that's what it
July
does.
28, 2011. The time, 2:06 a.m. Please apply blood to the test strip.
Okay. Some people think that it's easier to put it on its side and scrape your finger along, like this. And some people feel it's better to go like this. So it's a very individual thing. The position of the strip actually does make a difference for a lot of people. One problem that we have is that when you rub the strip against your finger, it really is hard to tell where the blood is, and quite often you'll smear it. And once you smear it, you can't get a good sample anymore. So one of the things I sometimes do is I'll use a technique where I'm going to start this over again.
Thank you for using Prodigy Voice. Today's date, July 28, 2011. The time, 2:07 a.m. Please apply blood to the test strip.
Okay. One thing that I do sometimes is I'll get a little bit of blood. And what I'll do is I'll just tap my finger on the tip of this. Like this. Slowly.
Now testing.
And as soon as you get a good sample, it'll tell you.
Your blood glucose, 245 milligrams per deciliter.
Now you probably wonder why I'm still standing. And the reason is I'm actually using fake blood. I'm using a control sample here. My actual sample isn't 245, I promise.
Goodbye.
Another technique you can use in order to get the blood on the strip is to use a CCTV to magnify your finger, as I'm doing right now. And I'm just going to poke myself here, like that. See a little drop of blood there? There we go. So we can match up the little drop of blood with the tip of the strip here using the magnification, kind of like this. There we go. Another test that's become clinically important is the A1C. And it turns out that red blood cells circulate through the bloodstream for about 120 days before they're retired. And during that time, the hemoglobin inside the red blood cells becomes glycated, or it slowly absorbs glucose during this time. The more glucose circulating through your bloodstream, the more glucose it absorbs. And it turns out that you can actually measure the amount of glucose in the red blood cells and get some idea of how your blood glucose has been, the average over a certain length of time, maybe 2 or 3 months. So we don't have any good home units right now. We do have this one here, but it requires several steps. It requires a lot of intelligence, a lot of patience, and unfortunately it requires a lot of vision. So it's not accessible yet, but I think it's promising, and maybe we will have it available hopefully in the future. So there's been a lot of evolution in glucose monitors during the last few years. It's amazing how quickly things are changing. And right now they're working on continuous blood glucose monitoring, so you always get a constant reading. It's not very accurate yet, but that's where they're going, I think, now. Products that support medication management for people who have both diabetes and vision impairment are always changing. Vista Center will post the products that I discussed today on Vista's website, and we will include new products as they become available. If you know someone with a vision impairment who is interested in learning about our services, please have them contact Vista Center for the Blind and Visually Impaired in Palo Alto at area code 650-858-0202, or in Santa Cruz at area code 831-458-9766. You can also visit us on the web at www.vistacenter.org. This video was produced with the help of a grant provided by Cisco Systems Incorporated.